Hello friends, today we will be discussing about a contour deformity case. This patient is a young girl. She has presented to us with a depressed contour deformity in the left elbow region. There is a back side of the just above the left elbow region. Now she gives a history of injury to the left elbow around at the age of 5 years, for which she underwent a fracture fixation of the left humerus, and subsequent to the healing process she developed a depressed scar in the left elbow just above the elbow region, the back side. It's quite a significant defect. As we can see, the defect is almost more than 10 centimeter in length, and in width is almost more than 4 to 5 centimeter. The scar line is sitting on the bone, is butting the bone, and we can hardly move the tissue and this central point of the scar. Rest of the scar we find a gentle depression till the midline. So this kind of problem is very difficult to correct in one go, that is in one session itself, because the procedure that we are planning is a fat transfer procedure to improve the contour deformity, which is safe and very nice and simple procedure for this kind of problem. In fat transfer procedure, what we do, we take out the fat from the lower tummy area, and thereafter we inject it in layers just below the scar line. So the filling has to be layers, and it should not be too much so that the central part of the fat undergoes necrosis. So it's a layer by layer fat injections, but the layer should not be too thick. We could achieve a significant correction following the fat transfer procedure. We injected almost like 25 cc or 25 to 30 cc of fat in layers, and the periphery of the scar line is almost looking normal, but the central part of the scar is still showing a depressed scar irregularity, and this needs to be further corrected in a subsequent session that will be done after 6 months. This is a very gratifying procedure for such kind of problem, because putting a flap is much more morbid and it produces much more scar lines, additional scar lines, which the patient may not want. For girls, it's become more important to give as little scar as possible, and fat does not end up in any scars, additional scars, and also it solves the depressed contour deformity, making it more leveled to the surrounding skin. Thanks so much for watching. I hope you got the message that any kind of depressed scar or depressed contour deformity in any part of the body, this fat transfer procedure is a very gratifying procedure, very safe and very foolproof procedure to correct such kind of deformity. Stay tuned to our channel and do refer to your friends and relatives for liking this video and the channel itself. Thank you so much.